Mrs. Eze had just woken up one morning and noticed a stain of blood on her bed sheets. She felt so shocked as she was over 60 years old and it has been more than a decade since she entered menopause. This can't be so, she thought. Disturbed by this sudden event, she confided in her daughter, who advised her to go and consult with a gynecologist. After much contemplation, she left her home for the hospital. On getting to the hospital, she consulted with a doctor and described her situation to the doctor. The doctor then sent her to the laboratory for some tests to be carried out. Weeks later, when her results were out, she went to the hospital and the doctor confirmed that she had cancer, cervical cancer, though something could be done. Cervical cancer is cancer that starts in the cells of the cervix. The cervix is the lower narrow end of the uterus. The cervix has two parts, the ectocervix and the endocervix. Cervical cancer develops gradually or slowly over time. Now, before cancer occurs or appears, changes occurs in the cell of the cervix, whereby abnormal cells appear. This is known as dysplasia. Now, these abnormal cells, when not treated or destroyed or removed, it becomes cancer and eventually spreads throughout the cervix and eventually to the surrounding areas. The part of the cervix where the cells appear is known as the squamous-columnar junction. Now, there are two types of cervical cancer. We have the squamous cell carcinoma. Now, this cancer starts in the cells of the ectocervix. And the second one is the adenocarcinoma. Cervical adenocarcinoma occurs in the glandular cells of the endocervix. Let's talk about the causes of cervical cancer. The main and common cause of cervical cancer is an infection with the human papilloma virus, HPV. Now, not all HPV cause cancer. There are different types of HPV. Well, we have what we call the high risk types and we have what we call the low risk type. Low risk types are those ones that afterward the body can fight, your body immune system can fight it and it clears or it destroys. Whereas it is these high risk types that usually transform to cancer. And the two main high risk type, HPV 16 and HPV 18, cause almost 70% of cervical cancer. Okay, now I want you to know that it's not just infection or being infected by this high risk type that leads to cervical cancer. It is when there is an infection with this high risk type that persists long enough. That is what can cause cervical cancer. Now, how does HPV cause cervical cancer? Once high risk HPV infects cervical cells, they interfere with the way the cells replicate, divide, and communicate with one another, thereby causing the infected cells to multiply in an uncontrolled manner. Now, these cells continue to grow and form an area of precancerous cells. It is now these precancerous cells, when not destroyed or removed, become cancer cells and spread deeply into the cervix and eventually into the surrounding areas. Now, there are 4 factors that increases the risk that HPV infection will cause cervical cancer. Number 1, a weak or a low immune system. Now, people that are immunocompromised in cases like HIV or any immunocompromised disease stand a risk that any HPV infection can cause cervical cancer. Also, people that take immunosuppressant drugs in situation of organ transplants, whereby they take this drug so that their body will not reject the organ transplanted. When infected with HPV, they also stand a risk that this infection can cause cervical cancer. The second factor is smoking and second-hand smoking. Now, you probably do not smoke, but you hang around people that smoke a lot. You stand at a risk that any HPV infection you have can cause cervical cancer. So, in as much as you don't smoke, reduce the rate at which you hang around people that smoke. And if you do smoke, stop smoking. Number 3, reproductive factors. Women that take birth control pills stand at a risk that HPV infection can cause cervical cancer. Also, women that have multiple births also stand at that same risk. The fourth and final one is obesity. Now, the reason obesity can cause cervical cancer or increase the rate that HPV infection can cause cervical cancer is that people that are obese, it's difficult for cervical screening to be done on them. So because of that, it's usually what's avoided, and then it's the HPV infection can what leads to cervical cancer. So let's talk about cervical screening. There are 3 ways cervical cancer can be screened. Number 1, we have the HPV test. Number 2, we also have the pap smear test. And number 3, we have the HPV or pap smear test co-test. Okay? Now, what does HPV test mean? HPV test is a test that is done to detect the infection of that virus. That means, for example, I do not know if I'm infected with the virus and I want to find out if I'm infected with the virus. The test I'm going to do is the HPV test. Now, the pap smear test. This test is done to dictate the changes. Now, this individual is already infected with this HPV, and the doctor wants to see the changes that the cervical cells must have undergone to know if it's at an early stage or at a late stage. You do the pap smear test. Now, the HPV test stroke the pap smear test done together is just the first test and the second test done simultaneously. Okay, so it is done to detect the infection as well as, if positive, detect what are the changes that has occurred in the cervical cells. So these are the 3 screening that is done to determine cervical cancer. Now, symptoms. Well, in most cases, symptoms are not usually seen in cervical cancer, in early stages of cervical cancer. But in a situation whereby there are symptoms in the early stage of cervical cancer, now symptoms you can see include vaginal bleeding after sex. 2, vaginal bleeding after menopause. Just like in our story earlier on, whereby Mrs. Eze woke up, she's over 60 years old, and she woke up to seeing blood stain on her bedspread. Now, bleeding in between periods or periods that are heavier and longer than normal. Number 4, discharge that is watery, has a strong odor, or contains blood. Pelvic pain or pain during sex. These are symptoms you can notice during early stage of cervical cancer. Now, symptoms of advanced cervical cancer. Number 1, we have difficult or painful bowel movement. Number 2, we have bleeding from the rectum during bowel movement, difficult or painful urination or blood in the urine. 3, we have backache. We have also swollen legs. We have pain in the pelvis, and we have feeling tired. These are the symptoms when you are already at the advanced stage of cervical cancer. So, prevention. How do you prevent this cervical cancer? One way you can prevent this cervical cancer is go and get a HPV test and take the HPV vaccine. Now, this HPV vaccine is usually given to to females between the ages of 9 to 14 before sexual activity, like young females that haven't had any sexual activities. This vaccine should be given to them. Now, for young ladies that probably are already sexually active, they should first of all do their HPV test to determine or to detect if they are already infected with this virus. And if negative, the HPV vaccine can also be given to them. This is one effective way to prevent cervical cancer. Another way is to use of condom to avoid you transferring it from one partner to another, though this prevention method is not 100% effective, but it's a start. So, dear ladies, go and get a HPV test done, and if negative, get the HPV vaccine. Thank you for watching. Bye.